The mental health issue I've chosen to discuss today is depression. What is it? Depression is a mental health issue that negatively affects the way you view the world, think, and act. It's a very common mental health issue that affects about 5.7% of the global population. More women are diagnosed than men, but this may be because women are more likely to seek help. It's curable with 70 to 90% of patients responding well to a wide range of treatments. You can become depressed at any age, but it is very common for teens, 20 and 30-year-olds. Symptoms of depression. There are many different symptoms of depression, and an individual may experience many of them or only a few. But in individuals diagnosed with depression, when they experience these symptoms most of the day, nearly every day, for over 2 weeks. There are both psychological and physical symptoms that will be noticed with someone with depression. Here are some examples of some psychological symptoms: ongoing low mood and sadness, feelings of helplessness, poor and low self-esteem, feelings of guilt, feeling irritable, loss of motivation and interest in things that were once enjoyed, difficulty in decision-making, feelings of anxiousness, and experiencing suicidal and thoughts of harming yourself. Here are some physical symptoms that may be noticed: slow body movements and slow speech, weight changes, this could be putting weight on or losing it, unexplained aches and pains, low energy, loss of a sex drive, and sleep disturbances. This could be not sleeping at all or frequently waking up throughout the night. Depression in Australia. Depression affects 1 in 7 Australians, making it the most common mental health issue in Australia. Studies show depression rates in Australia have been steady over the years, so whilst not getting any worse, they aren't getting any better either. However, the use of antidepressant drugs and psychological treatments have skyrocketed. Studies show 1 in 10 Australians take antidepressants every day, and there are now 20 psychology services per year for every 100 Australians. But it really makes you wonder, why aren't the depression rates coming down if all these treatments are being used? In theory, depression rates really should be coming down from the increase of treatments. It is suggested that the reason behind it is that the treatments that are being received aren't up to standard. I found a couple of examples. So, antidepressants are being described to individuals with mild depression who may not actually need to be medicated, but just using forms of psychology and lifestyle changes may help them. Medicare also only helps subsidize 10 sessions of psychology a year, but through my research I found that studies show you need 16 to 20 sessions to treat depression. Risk factors. There are certain factors that can lead to an individual developing depression. These can include personality traits, things like low self-esteem, pessimistic personalities, and people that are very self-critical. Trauma could be physical, sexual, or grief. Genetics, if your parents were subjected to have depression, then you may as well. History of other mental illnesses, so if you've got something like an eating disorder or anxiety, you're more likely to develop depression. Alcohol and drug abuse, chronic illness or pain, and certain medications. Treatments. Unfortunately, depression is unlikely to go away on its own, but there are many great treatment options available for individuals that are seeking help. Treatment for depression is definitely not a one-size-fits-all, so it may take some time to find what best works for you. And in that time, it's important not to give up because the thing that works for you might be the very next thing you try. For mild depression, it may be relieved by lifestyle changes. For example, incorporating exercises into daily routine, this, as well as seeing a psychological therapist, may be enough to relieve all mild symptoms. The pros for these treatments are it's often quite a quick and relatively easy recovery. A con is that the individual has to take initiative for their own care, so if they're trying to make their lifestyle a bit better, you've got to kind of do that on your own. For moderate to severe depression, using those same treatments combined with an antidepressant medication should eventually relieve all your symptoms. It's important to note, antidepressants won't work on their own to cure depression. The antidepressants will increase your serotonin, which can help make it easier to receive treatment from a psychological therapist. Once you've worked through your challenges and developed long-term coping mechanisms, you can then slowly wean off that medication. The pros for these treatments is that you've got lots of help, both from the medication and the psychological therapist. But a con is that some may struggle coming off the antidepressants because there can be some mild to more severe side effects. There are many different treatment options that psychological therapists can provide. Some examples are cognitive behavior therapy, otherwise known as CBT, interpersonal therapy, otherwise known as IPT, and behavior therapy mindfulness-based cognitive therapy, otherwise known as MBCT. The most common one is CBT. This treatment option helps people with depression change those negative thinking patterns and gives them skills that equip them to deal with life and all its stresses. Trauma and depression. The link between trauma and depression is complex but undeniable. A traumatic event, specifically in early childhood, but also at any time in your life, can put you at risk to develop depression, as it can negatively alter the brain's chemistry to the point where it can even mess with the production of serotonin, which is closely linked with depression. This can create depression symptoms such as sadness, feelings of worthlessness, irritation, loss of interest in things once enjoyed, and if not managed well, can develop into severe depression. To sum it all up, depression affects millions of people, and while it's encouraging that more people are seeking help, the support available still needs to improve if we truly want to reduce depression rates. Throughout the SNUG 206 class, I learned about the various levels of depression and how it can intertwine with other mental health conditions, such as anxiety and eating disorders. The course taught me how to recognize the symptoms and understand the available treatments for depression. As a result, I now feel more equipped with the knowledge and skills to support my future patients effectively when I encounter these challenges in the real-world settings.